Hello, I'm Bruce Langland, founder of the Meningitis Centre in Perth. Meningitis can be a very serious illness. However, if it's diagnosed and treated quickly, most people survive. It's important to know what to do because every second counts.
Meningococcal disease is a devastating illness that can kill within hours of the first symptoms appearing. That's why urgent treatment is the key to saving lives. Very often the onus is on family members and friends to recognise the symptoms and seek urgent medical help. That's why it's just so important to know what to look for. The terms meningitis and meningococcal disease are often confused. To understand their relationship, let's look first at the nature of meningitis. Meningitis is inflammation of the lining of the brain, or the meninges. The illness can take many forms, ranging from mild to severe, and can be caused by many different organisms. Meningitis is most commonly caused by a virus. This can make people very ill, but it's not usually life-threatening. Meningitis can also be caused by bacteria, and this is much more likely to be life-threatening. In this program, we'll be focusing on bacterial meningitis. There are three major types of bacteria that can cause meningitis. Hib, which used to be the most common cause of meningitis in children, but is now well controlled by vaccination. Pneumococcal, which is the most severe form of bacterial meningitis in terms of death rate and disabilities, but its incidence has been largely controlled in recent years due to vaccination, with an even more effective vaccine due within just a few years. And finally, meningococcal, which is still a major problem as it is yet only partly controlled by vaccination. When meningococcal bacteria invade the body and multiply, it's called meningococcal disease. Meningococcal disease can have two different forms and two different sets of symptoms, depending on where in the body it invades. When the bacteria invade the brain, we call it meningitis. When the bacteria invade the bloodstream, it's called septicemia or blood poisoning. Septicemia is the most dangerous form of the illness, and if it's not treated in the early stages, it can lead to severe disabilities and even death. It is quick action that can save a life. Awareness and applied knowledge are absolutely vital. Meningococcal disease most commonly targets babies and young children up to the age of 5 years, as well as teenagers and young adults up to the age of about 25. But it's possible to catch this disease at any age. Most cases of meningococcal disease will survive without any ill effects if they're caught early. That's why knowing the symptoms is just so important. A very distinctive feature of meningococcal disease is the sudden onset of symptoms and feeling much more ill than ever before. If the bacteria invade the brain, causing meningitis, you may have several or more of the following symptoms: fever, vomiting, severe headache, a stiff neck, sensitivity to light, confusion or agitation, drowsiness, and convulsions or fits. Symptoms relating to septicemia or blood poisoning may include fever and vomiting as before, but also cold shivers, cold hands and feet, pale or mottled skin, pain in the arms, legs or stomach, unusual thirst, rapid breathing, drowsiness, and a pinprick or purple rash that may enlarge in size. Additional symptoms in babies may include refusing solid feeds, a high-pitched cry or moaning, lethargy, floppiness, fretfulness, poor interaction, a blank staring expression, an arching of the body or neck, and finally a tense and bulging fontanelle, which is a soft spot on top of the head. The symptoms may appear in any order, and not all of them will appear. The rash, though, is a very important warning signal. This often starts with tiny red pinpricks or a small bruise, and may develop into purple blotches as the blood poisoning becomes severe. You can do a quick test at home to work out if the rash is serious. Take a clear drinking glass or tumbler and press it against the spots. If the rash fades and disappears, it usually means that it is harmless. However, if the spots don't fade and there are several other symptoms, this could be a meningococcal rash. This test is not 100% reliable, so even if the rash does fade when you press the glass against it, it could still be meningococcal disease. I really must emphasise that if your child or friend is very unwell and has several meningococcal symptoms, then it's very important not to wait for a rash to appear before seeking medical help. They should be taken straight to a doctor or emergency department. If there is any suspicion of meningococcal disease, the patient should be treated with intravenous penicillin, or if allergic, another antibiotic. This should be done immediately, without waiting for any test results. Giving antibiotics in the early stages can stop the disease in its tracks. While you can vaccinate against the C strain of meningococcal disease, there's no vaccine for the B strain, which is more common and can be just as deadly. So whether you're vaccinated or not, it is vital to know the symptoms and the signs and to seek early treatment. With meningococcal disease, every second counts.